So if you didn't know by now, medic school can be an absolute bear to get through, especially when a lot of you are, say, working full-time while commuting long distances, such as 5 hours over a mountain pass midwinter, just to get to your ride time. True story. The point I'm trying to make is that I know how difficult medic school can be, which is why I created so many flashcards to help me keep key points of information fresh in my brain. And luckily for you, I didn't celebrate graduating medic school the same way I celebrated graduating grade school, by burning every trace of it. Which means I can share it with you. So stay tuned for flashcards 41 through 50. My name is Zach, and this is Paramedic Zach. Alright guys, so welcome back, or welcome for the first time, and we're going to be moving on to question 41. So, during heat stroke, the patient's core body temperature will increase to greater than or equal to blank degrees Fahrenheit, which is blank degrees Celsius. Alright, so the answer is going to be a core body temperature of greater than or equal to 106 degrees Fahrenheit, which is 41.1 degrees Celsius. Moving on to question 42. Name the condition. Your patient presents with sudden onset chest pain, sudden onset shortness of breath, tachypnea, normal lung sounds and ventilation, decreased SpO2, cyanosis, and possible cardiac arrest. So these symptoms here are prompting you to look in the direction of a pulmonary embolism. Moving on to question 43. The mitral valve is located in which ventricle? So if you didn't know the answer to this one, you have a 50-50 chance, but the mitral valve is going to be located in the left ventricle of the heart. Question 44. What is the criteria for orthostatic hypotension? In order to check if your patient is presenting with orthostatic hypotension, you first need to take a blood pressure with that patient lying down. Then you're going to take another blood pressure after the patient has been sitting up or standing up for about a minute. If the patient's systolic blood pressure has dropped 20 millimeters of mercury or greater after sitting up or standing up, then that patient is positive for orthostatic hypotension. Question 45. On a 12-lead ECG, one big box is equal to blank millimeters and blank seconds. So on a 12-lead ECG, one big box is composed of 5 smaller boxes. Each of the smaller boxes are 1 millimeter or 0.04 seconds. Therefore, 5 smaller boxes, which is one big box, is equal to 5 millimeters or 0.2 seconds. Question 46. The signs of DKA or diabetic ketoacidosis include these 3 things. Hint: breathing, skin, pulses. So diabetic ketoacidosis is a dangerously high blood sugar, which is going to typically present with 1. Kussmaul respirations, which are deep and fast respirations, 2. Hot, flushed skin, and 3. Bounding pulses. If you see these 3 things in your patient, then there's a good chance that that patient is going to have a very high blood sugar. Question 47. What carries oxygen in red blood cells? And the answer here, guys, is going to be the hemoglobin. Hemoglobin. Question 48. The hallmark sign of Croup is blank. Alright guys, I'll give you a hint here. Of course, the hallmark sign of Croup is going to be the seal bark cough. Question 49. Name 3 ECG diagnostics which represent hyperkalemia. Hint: what happens to the QRS? So the first and one of the most widely known representations of hyperkalemia on an ECG is going to be tall, peaked T waves. Secondly, you might also find that you have flattened P waves. And thirdly, with severe hyperkalemia, you're going to see a widening QRS complex. All right, and last up we have question 50. You can treat symptomatic bradycardia with an infusion of either blank at blank to blank micrograms per kilogram per minute or blank at blank to blank micrograms per minute. So of course, if your bradycardic patient is presenting poorly enough, you're going to move right on to transcutaneous pacing. However, if TCP doesn't improve your patient's condition and your patient is hypotensive, you can try a pressor. A pressor is going to increase the patient's blood pressure. One you might consider is dopamine at a dose of 2 to 20 micrograms per kilogram per minute. Alternatively, you can try epinephrine at a dose of 2 to 10 micrograms per minute. Alright, so that's gonna do it for this episode. This officially puts us 1/10 of the way through these flashcards with only 450 to go. As I said in the last episode, eventually there's going to be a part 2 to these episodes where I'm going to go over each question in depth with some more explanation. However, the next few episodes are all going to be quick review. With that being said, if you liked this video, could you do me a huge favor and give me a thumbs up in the description? It helps the channel a lot, and if you want to get these videos regularly to help you pass your exam, make sure you hit the subscribe button. Thank you guys for joining me, and I'll see you next time.